Welcome to the Refugee Community Partnerships Health Information video series, where we will be sharing basic information about common health topics. In this video, we will be discussing hypertension. You may have heard of the term hypertension before. Maybe you've heard that on TV, maybe you know a family member or friend that has it, or maybe your doctor has spoken with you about it before. Hypertension is also known as high blood pressure. This video will be a basic video about what is hypertension and why it is so important that we manage it well. Let's start with understanding what part of the body we are talking about when we talk about hypertension. Hypertension is related to what is called your cardiovascular system. Your heart, blood vessels, and blood make up your cardiovascular system. The heart pumps blood through the body so that all parts of the body receive oxygen. Hypertension, or high blood pressure, is when the blood in your body is constantly putting a high amount of pressure, or force, on the walls of your blood vessels. When your blood pressure is high, the heart has to work harder against this pressure to pump blood to the rest of your body. Many people can go without knowing they have hypertension because often there are no symptoms. But when a person has high blood pressure for a long time, the heart and blood vessels become less efficient and start to not work as well. The constant stress from high blood pressure damages the tissues of your blood vessels. This can lead to serious conditions such as heart attacks. In addition, high blood pressure puts stress on other organs such as your brain, which can lead to strokes or headaches, your kidneys, which can lead to kidney failure, and your eyes, which can cause vision problems. So if you or someone you know has high blood pressure or is worried about having high blood pressure, please visit your doctor. When your blood pressure is measured, you have two numbers, a top one and a bottom one. The first number, or the number on top, is the pressure measured in the blood vessels when the heart squeezes and pushes blood out during a heartbeat. The second number, or the bottom number, is the pressure in the blood vessels when the heart relaxes and is filled with blood between beats. When you go to the doctor's office and the nurse puts a blood pressure cuff on your arm, the cuff is filled with air and measures the pressure of the vessels in your arm when your heart squeezes and relaxes. By now, maybe you've asked yourself, how does someone get high blood pressure? For most cases, we do not know the exact cause of why someone has high blood pressure, but we do know that high blood pressure tends to run in families, and as you get older, you're more likely to get high blood pressure. We also know that certain things like cigarettes, having too much salt in our food, drinking too much alcohol, not exercising or staying active, and high levels of daily stress can make blood pressure higher for a long time. Other health problems such as diabetes, having too much weight, and problems with your kidneys can make it easier for you to get high blood pressure. For some women, becoming pregnant may also cause them to develop high blood pressure. With all these different risk factors for high blood pressure, how do you know if you have high blood pressure? Whether you get your blood pressure measured at a doctor's office, clinic, or pharmacy, you should be aware of the recommended blood pressure values. In general, a blood pressure more than 140 on top or more than 90 on the bottom is considered high blood pressure. Different people have different blood pressure goals, and your doctor can tell you what your goal is. There are many actions you can take to reduce your risk of getting high blood pressure. Eating a healthy diet with moderate amounts of salt, exercising for at least 30 minutes a day, 5 times a week, limiting your levels of stress, not smoking, and maintaining a healthy weight can help with preventing high blood pressure. These are also good practices to use to manage hypertension if you already have high blood pressure. If you have been diagnosed with hypertension by a doctor, they may have already suggested these to you. You may also have been prescribed medication to lower your blood pressure. It is important to take this medication exactly as your doctor has told you to do so. If you need to stop a medication because you don't feel well when you take it, please let your doctor know right away. You should never stop a medication without letting your doctor know. Hypertension is usually a condition that lasts a long time. It is important to continue to take your medications and to eat and exercise well to lower your blood pressure. If you stop taking your medications, your blood pressure will go back up. If you run out of your medications, please let the doctor or nurse know. Here are the key points to remember about hypertension. Hypertension, or high blood pressure, is when the blood in your body is constantly putting a high amount of pressure on the walls of your blood vessels. You may not have any signs that your blood pressure is high, but if your doctor says you have hypertension, it is important to manage this condition because over time it could damage your heart, brain, kidney, eyes, and other organs. You can manage hypertension by taking your medications regularly and managing your diet, exercise, and stress levels, and by not smoking. Please talk to your doctor if you have any further questions or concerns. If you would like more information, please go online and visit the CDC or the American Heart Association at the websites listed here. If you would like to learn more about the Refugee Community Partnership or watch more health information videos in English, Korean, Burmese, or other languages, please visit our website at refugeecommunitypartnership.org. Thank you.